Okay, let's get started. Welcome to today's Harvard Data Science Initiative Industry Seminar. I'm Jen Chow, I'm Director of External Engagement, and I'm pleased to introduce today's speaker, Andrew Schroeder from Direct Relief. Andrew Schroeder is the Vice President of Research and Analysis for Direct Relief. He leads their work in data science, GIS, and humanitarian innovation. His work is hugely influential and has been featured not only in the academic press, like Science and The Lancet, but also in the popular press, like the New York Times and the Washington Post. Together with colleagues at the Harvard T.H. Chan School of Public Health and the Harvard Medical School, Andrew is a co-founder of CrisisReady, a program of the HDSI, which is a data research and response platform that translates location data into actionable information during disasters and health emergencies. Here at HDSI, we've been so delighted to be a part of their journey. It's a perfect example of our work to invest in and nurture data science for impact. So before I hand over to Andrew, I'd like to remind our audience that there will be time after his presentation for questions. Audience members, please use the Q&A function to send in your questions at any point during the presentation. And I always say this, but please don't be shy. All questions are good questions. All right, thank you, and welcome, Andrew.
Thanks, Jennifer, and welcome to everyone. I apologize in advance for any background noise. I'm coming to you live from Medellin, Colombia today at the United Nations World Data Forum. So I am in the quietest place I can find. Let me quickly share my slides. Great. So, as Jennifer said, I'm Andrew Schroeder. I'm going to talk to you about some of the work we've been doing through CrisisReady and contextualize that in terms of direct relief, and think mainly about a set of problems that are focused on how we understand change in humanitarian assistance. So change is a fraught topic. It involves measurement in space and time. It involves data sources often that are novel or produced for purposes that are other than the problems that we're trying to solve, and require special handling in terms of how we engage with the acquisition of them, with questions around privacy or community dynamics, data protection, other things. But it's arguably the most important thing within humanitarian assistance, because everything that we're working on moves in space and time in ways that are significant to the ability to provide assistance. Just to give you a little bit of background on Direct Relief, Direct Relief is a humanitarian aid organization that works in the health sector. So it's principally a medical logistics organization. So the primary modality of assistance is the delivery of essential medicines and medical supplies to local healthcare programs and other hospitals and public health systems around the world to help them to respond to crisis, and to provide medical financing for systems improvements, ranging from power to cold chain to training and staffing and other elements, and to listen carefully to that network so that we understand sort of the changing dynamics that people are facing that will improve access to health services in crisis. So everything that we're doing is in the service of that mission. Direct Relief is a global network. I used to think that there were places that were off limits to what we were kind of working on, but that is decreasingly so, principally ever since the pandemic. And we maintain an active network of local partnerships all over the world that we're regularly in dialogue with and providing support to, and that also changes dynamically as crisis changes, which we'll get into later on. So one of the ways to think about Direct Relief is as an aid organization that does three things. So I mentioned already that the primary modality is the provision of medical aid, so access to pharmaceuticals and medical supplies of various kinds. granting or the ability to identify needs and provide financial resources that access to medicines don't actually resolve, and then increasingly information as aid, or analytics as aid, or data as aid, depending on how you want to frame it. And that's really where CrisisReady came from. CrisisReady is not the only thing that we do in those terms, but it's been one of the ones that's consumed a lot of my time over the last several years. So it's one I'm going to talk about. Um, CrisisReady is a partnership between Direct Relief and HDSI, as Jennifer was saying at the beginning. Other than myself, it's co-directed by Sachin Balsari and Caroline Buckey at Harvard, who have really focused it a lot on health systems in different ways, in different geographies. And I think the kind of key questions that CrisisReady was convened in order to solve, and which have evolved as our sort of operational activities and research have evolved over time, entails how we mainstream or translate novel data sources and methods into operational activity, into preparedness, response, and recovery. So the goal is really practical. It's applied data science for the purpose of mainstreaming novel data sources. And again, novel data sources is a term I'm using here to mean data that is collected for a purpose that's very different from what it's being applied to. And we'll talk about a bunch of different examples of that. But we also want to be able to create learning networks across public, nonprofit, and private agencies, improve their capacity to apply data and methods in new ways to what they're doing, because it's actually sort of inefficient to do this from a centralized point of view. So being able to extend that out into local partnerships is essential to the operational idea. And that often, I think, requires creating new institutions and new institutional arrangements that support and sustain the growth in analytics capacity. And often this is the harder part than actually doing the analysis, is working in partnership with others to make sure that we're locating capacity in the ways that are most likely to be able to actually be used to solve problems. So just a really recent example of some of the work that has come through CrisisReady. So it's been an active hurricane season in the United States. Hurricane Milton struck the coast of Western Florida not that long ago in October, and it was on the heels of Hurricane Helene, which also struck Western Florida, but then moved up and had its greatest impact in North Carolina, in the mountains in Western North Carolina, and devastated the city of Ashland. And there's always a lot of concern when these kinds of events happen that, mandates are issued or not issued in time, that people need to get to safety. They need to protect themselves and their communities, and often that depends on official orders that are sent in. And often it's not entirely clear the degree to which people are following these orders. So recently, we did some analysis using data that's derived from the Meta platform to understand the evacuation dynamics in Hurricanes Milton and Helene. In the case of Hurricane Milton, where mortality was relatively low, we discovered that actually the evacuation patterns were quite effective when you look at the different zones that people were being ordered to evacuate from, mandatory versus voluntary. So this is looking at October 10th at 4 p.m. Eastern Time, and where the population is lower or higher than baseline according to the data on the Facebook user base. And this gives you a sense of where things were lower or higher than expected. And you can see some areas that were actually kind of near the line of fire that you might be actually somewhat concerned about. And the graph on the right-hand side gives you an indication of sort of how people moved by evacuation zone relative to the timing on where those orders were issued. And so the mandatory zones were A and B in this case, and as you get up in the alphabet, that's a little bit farther away from the coast, although there's some geographic variation that complicates that. But where you see kind of spikes of activity that are happening in areas that are evacuation zones, but are farther away from the coast. And so places, however, that emptied out were right on the sort of right on the coastline and somewhat further in. And so this gives you a sense that mandates to evacuate were actually quite effective here, and this is borne out actually in the mortality numbers. So unlike sort of previous hurricanes, Hurricane Ian, for instance, which was the deadliest hurricane that Florida experienced, in this case, evacuation orders worked quite well. So that's really practically useful for being able to inform what people are doing in the response to a crisis. I mentioned that came from the Meta platform. So Data for Good at Meta is one of the principal data providers here, and Meta takes data from the Facebook Blue platform, aggregates that into 800 meter on a side grid cells, measures that population that's present on the day of a crisis relative to a pre-crisis 90-day baseline. And then we can make heat maps like the one I just showed you in Florida of the relative density of the population. It's somewhat representative of the population depending on where you're looking. So the representativeness varies over time and space. Areas that are more urbanized tend to be more highly represented. Areas that are more rural tend to be somewhat less representative, although often that's between a 15 and a 25% population sample, which is extremely high relative to all kinds of other things that we use to evaluate what happened in a crisis. Second example of sort of recent activity, and that gives you some other work that we've been doing, is happened with the Dixie Fire, which took place in Northern California near Lake Almanor in July and August of 2021. And here we've built a platform called ReadyMapper, which integrates a significant number of data sources that help us to, in combination, understand some of those dynamics in crisis. So what you're looking at here is the fire perimeter as of August 7th at 3 p.m. Eastern Daylight Time. This is also looking at the census population. So Lake Almanor is in the middle there. There's a power outage that you can see. So we take power outage data that is scraped from power providers by a company called poweroutages.com and link that into particular ACS place locations so that we can understand sort of what communities are facing in terms of their exposure to hazard. And this is looking at age as a proxy for vulnerability, so that people that are 65 or older have greater exposure to chronic illness. They're at greater risk of being dislocated from access to medicines. And so we're particularly concerned that also tends to be a proxy for a range of other vulnerabilities. So it's not the only factor that we're interested in, but it's a pretty good one. So then this looks at the mobility data for that area. So this is a heat map on the same day, looking at where Lake Almanor has been, somewhat depopulated, and there are nearby areas of population increase. And actually, if you go out and look at then the travel times relative to infrastructure, we can see the probable pathways where evacuation will take place. So this is looking at where travel distances are by car relative to that hospital that you see on the shores of Lake Almanor, and that indicates that most of this sort of westward routes out of Lake Almanor are blocked by the fire perimeter, and really places a lot of the focus on Susanville, which is to the east. It's where most of the other sort of significant medical infrastructure is in the area. So then, working to then understand what the resourcing requirements are for medical infrastructure that would be exposed, given that they're likely to see shift in population out of this area as evacuation becomes increasingly important due to the progression of the fire. So you move it forward in time. The fire perimeters are based on remotely sensed imagery, looking at where the new areas are. We can see at this point that the fire has jumped, or the fire hasn't jumped yet, but the population has begun to evacuate. And you move it farther in time, and the fire itself jumps towards the highway and that makes the health situation more critical in that area, and provides a window into thinking tactically for health responders for how to be able to understand resource allocation and movement patterns for the health system in that area. So we are routinely using ReadyMapper in a range of different emergencies, both in the United States and internationally, to do this kind of work. So I wanted to just shift into then thinking about like other areas of novel data that inform this kind of thinking about change and why this is significant to the work that we're putting together. I don't really pretend to have all of the answers in terms of the sort of appropriate modeling to be done to link all of this together in ways that are going to yield the best possible insight. And that's something we're always in the process of researching. So we're trying to link research into operational dynamics and in order to be able to answer that question. But human mobility is probably the most salient. For a lot of the work that we're doing, disaster events and understanding damage is the second, and then I'll look a little more at power and data networks, which you've already seen a little bit of, but we'll go into a bunch of other examples. From my point of view, the sort of big bang on human mobility data and integration into crisis response, which has a long history prior to 2020, was nevertheless the pandemic. When the pandemic struck, we had been already working with public health and emergency management agencies on the use of some mobility data for response to crisis, and a range of public health research had been done to understand the utility of that data for response to vector disease outbreaks and other health dynamics. But during the pandemic, there was this operational demand for understanding non-pharmaceutical interventions at scale and informing government about what was happening. And this created a new kind of context for the direct use of novel data in public health planning. There's a lot of resistance often to the use of novel data for a variety of good reasons often, in terms of accuracy, in terms of the degree to which it can be treated as an official source, the degree to which it has been controlled for certain privacy and data protection concerns. And the pandemic meant that we had to kind of move quickly at scale. But the bottom line was that, and this was expressed by Carolyn most clearly in the article in Science, that this did actually have very immediate practical concerns, and therefore not doing this would produce its own hazard. Lots of companies began producing this at the time, and this was sort of important for the context, so that novel data began coming out of the woodwork for response to similar problems. Google produced this, Apple produced this, companies like SafeGraph produced data from advertising technology on your cell phone that does give also a similar kind of movement signal. And public health agencies and responders were really overwhelmed with trying to make sense of the distinctions between these data sources and the best way to put them into operational practice in their own work. And so we formed the sort of progenitor of CrisisReady around COVID-19, specifically to be able to pair researchers and responders with health agencies that needed to understand what this data could tell them, how to adapt it to new situations, so very novel, changing situation that like changed the questions that were being asked in very different ways as the pandemic progressed, and that could act as a learning and knowledge sharing network so that this work could improve over time as we also became more aware of what are the most salient questions, what are the methodologies that are required in order to answer those questions, and where do we really need to focus in order to make the most difference in the response. So, in my own role, I worked with the governor's office in California around this, and we began looking at the county level to be able to understand the rate at which people were staying home or going out to keep the level of aggregation high enough that it was meaningful, yet very protected. integrated into their daily briefings so that the governor's office could rely on the signal and felt confident in being able to articulate the messaging from that signal, which was a key element of what we call translational dynamics, so that we were working to make sure that when they offered public health messaging, they were confident in what it meant, what it didn't mean, and what kind of risks they needed to be aware of in putting this messaging out, given that messaging itself was one of the primary response modalities here. And then, paired up a range of different researchers with places like Santa Clara, California, to look really locally and specifically to respond to their local issues in understanding mobility dynamics. Seattle, Washington, where we began looking at land use patterns and how that related to mobility dynamics and whether that could then forecast into some of the policy directives that were significant to the response at the time. So this is, one of the things that became apparent through the research is that understanding the production process to this data, how it actually can be used to measure change, is absolutely essential and needs to be then part of the taken for granted kind of intellectual infrastructure for the use of this kind of novel data. And we gathered together a range of different responders in the humanitarian community, in the research community, in the data provider and technology community, and published a white paper that specifically goes into what the sort of most salient issues for from the data to the practice side were in using this, and translated that then very quickly over into a range of other disaster response efforts. We sort of systematize this into thinking about three dynamics. One around readiness, and this is when CrisisReady was formed, around data, methods, and translational readiness. So in order for novel data to make a difference, the data itself has to be organized into pipelines. It has to be there have to be sharing agreements in place. There have to be it has to be cleaned. It has to be we have to have assurances that it's going to be refreshed on some reasonable time frame in order to be able to align that with the temporality of the response. Often, methods which have range from just simple time series analysis into increasingly using AI to ask about different relationships that might be salient in a particular area, are things that you don't necessarily want to be inventing in the middle of an event. So linking that to research has a really practical component, because the methods are have to be relied on and they have to be explainable. Health agencies and emergency responders won't use methods that they don't understand. And so we have to be very clear and very direct about what that means and what it doesn't mean. And that is what then contributes towards translation of data into operational workflows that then can be applied to a range of public safety and humanitarian needs. So just another example of like where this sort of can make a difference, this sort of approach towards novel data for response to crisis. I mentioned that we've been very interested in damage impacts and understanding sort of how has not only the entire landscape of an area been impacted, but often specifically how much can we know about potential impacts on the health system in advance. This is traditionally done through on-the-ground field methodology, surveys, going to places, ground truthing, all of that. It remains very important, but it's slow, and there's a question that has a number of people have addressed over the years around use of Earth observation data tied to machine learning to be able to make certain reasonable claims about probable damage in various areas. So one of these models that has been actually quite valuable for us was produced by Google and uses satellite imagery trained on observational data and feeds into a model to be able to predict the likelihood that a particular building is damaged or not, and on a scale from no damage to major damage. I would not say that this is well integrated into emergency response workflows, but it's highly interesting and provocative, and we've integrated into data collaboratives in response to events like Hurricane Otis in Acapulco. So Hurricane Otis, which happened in November of 2023, was an enormous event that devastated the city of Acapulco. So the scope of damage was just enormous. Hundreds of thousands of buildings in the city of Acapulco were badly damaged. Acapulco is a very unequal city. So the landscape, it's a tourist city, but it's also a very poor city. And there's sort of challenging political dynamics in the city related to wealth inequality and other things. And so Data Collaborative was formed involving actors from the UN, from the Mexican government, from nonprofits like Direct Relief and research agencies like CrisisReady to be able to inform that and to bring novel data sources to bear. So this is looking at the landscape of sort of aggregating into hex tiles the building evaluations that so that we can understand parts of the neighborhoods where where building damage may have been greater or lesser, and you can sort of start to see, oddly enough, that the coastal areas are lower impacted than the more inland areas, which is sort of counterintuitive given that the hurricane came ashore through the coast. We sort of were asked by the state of Guerrero as part of this sort of translational process to then make sure that we could connect that back into neighborhoods so that they could link it into population variables more easily and understand that how that could fit into their own process of going through and doing ground root checks and evaluating the impact on the city. And again, here you can see the coastal areas much lower affected than these inland areas. A lot of that is attributable to the type of building that's done there. So on the coast, you have a lot of hotels, sort of heavy concrete infrastructure, actually held up to the storm relatively well. And the building dynamics change dramatically as you come in from the coast. You have things that are maybe on the edge of informal settlement, may have much lower quality roofs, and were really devastated by the wind impact from the storm. And these are also poorer areas of Acapulco, and there was some political challenge around what this message indicated to the sort of relationship between the impact landscape and the social inequality landscape within Acapulco. And when we then kind of overlay that with where health facilities are, we can get sort of an initial view of the likelihood that a particular facility was in a certain kind of damage zone. So this doesn't necessarily say that the facility itself, we know it was low to minor damage. We know that it was in a low to minor damage area, and it helps with being able to at least form hypothesis early on in the response effort around sort of where the priorities ought to be in thinking about which facilities are going to require more attention, and potentially in thinking about how the denominator changes in terms of things like drug supply, access to medicines, and other things that are going to be very significant for operational aid flows in the health sector. When we sort of think about internet as one of the other sort of important dynamics here, we have been working through, this is again a data set that we received through Meta, which measures the likelihood that the user base as a whole, not sampled with location, in so because this isn't looking at people, this is looking at connectivity, are able to connect to cell towers. So it gives us a heat map of where there is the presence or absence of network connectivity on a given day during a crisis. So this is looking at the coast of Northeast Spain. in the end of October, beginning of November, there were devastating heavy rainfall events that happened starting on the 29th and 30th, extending into the 1st, and with intermittent impacts thereafter that have caused a huge loss of life. Over 200 people have died. There were, as of the time we were producing this, 1,900 people still missing as a result of these. And agencies were asking about whether we could understand the network impacts in the area and the rate at which certain areas were coming back online for the purpose of being able to facilitate crisis communications and other things. And so when we look here, we can at least see where areas were coming back on at different time frames. So this is looking just on the outskirts of Valencia as network came back online around the 2nd, and then further north, actually not until the 5th of November did you start to see some of these areas come back online. And then that can be related back into population. So similarly, going back and looking at network connectivity in the recent impact of Hurricane John, we were asked by the Federal Institute of Telecommunications in Mexico to help them to understand a similar kind of thing. So where are areas that were impacted by Hurricane John out of network connectivity, and roughly how many people are there. So this links together an understanding of this connectivity landscape in Michoacan, which is also a challenging province to work in, and the world population estimates, which is gridded population for the area, that lets us look at the number of people that were in an area that, as of the 26th of September, which is a couple days after the impact of the storm, where there was no detectable internet signal at all. And this is over 300,000 people that were outside of internet service. And that can also then target how they think about recovery of network services and why certain places might not be responsive in terms of accessing and asking questions about the kind of broader scope of humanitarian need. So that's looking at then sort of different dimension of novel data. Again, putting that into this readiness framework so that we have pipelines ready to go around these issues of human mobility, of damage estimation, of access to networks, access to power, related to baseline population, social vulnerability, other kind of health infrastructure distributions, and that feeds into specific questions that have been pre-formulated so that we can aim the methods at what's most likely to be useful for those questions. And then to work in partnership with others, which could range from a variety of different folks. I've mentioned a range of different types of agencies so far, to be able to translate that into their workflows and to respond iteratively to the questions they're asking as they change over time. We've sort of put this into practice around a set of workshops that we've carried out over the course of the last few years, ranging from work in Budapest, Hungary, around the Ukrainian refugee crisis, into here in Colombia, in Bogota, mostly around public health and disasters. And in other cities, we just did one up in working in partnership with California Office of Emergency Services to look at the needs for novel data sources in California's public health and emergency response system. And in the next month or so, we'll be working in partnership with CENAPRED, which is the National Disaster Risk Reduction Institute in Mexico, and a whole range of other partnerships, both governmental and non-governmental in Mexico, around how novel data and methods can translate into the revision of their disaster risk reduction framework, in formulating improved simulation exercises so that we can practice how novel data can make a difference to some of their efforts at preparedness, response, and recovery, and then sort of how to build on that in partnership. So sort of the next phase of Crisis Ready, as we've been sort of thinking about kind of how to build upon this and how to extend this partnership into where it needs to go is to really invite people in, and to ask the question of whether you're crisis ready. In order to be able to, we've learned a lot over the years about novel data sources, about the agreements and policies that need to be in place, about methodology, about how to be able to practice this and put this into curricular frameworks that can train organizations to do this work themselves and to form the kinds of networks that were really invaluable during the pandemic when we were trying to make a difference at scale and speed, to understand things like the distancing orders. Building tools and models like ReadyMapper, applications of generative artificial intelligence to help with some of the sort of answering questions that needs to happen in these cases and turning those into formalized local hubs. You can join us, get in touch. I put my information up there, the website for Direct Relief and for CrisisReady, so check it out. You can, we no longer post on the X platform, but you can find us on LinkedIn, and I would be happy to answer any questions that folks have about any of that or how it fits with Direct Relief or other things on your mind. And that's it for me. Thanks.
Hi, everyone. Andrew, thank you so much. That was really terrific. And while I give folks a chance, we've got some really great questions here, but while I give folks a chance to add their questions, I did want to go back to your framework of data readiness, methods readiness, and translational readiness. Where would you say is the weight of your work when you're thinking about each of these, how you approach each of these areas? Where do you find that you spend the most of your time or concentrate the most of your resources?
I think the most time is spent on the translational readiness dynamics. I mean, I think what's crucial is to make sure that you're listening to the right questions. So if you're not listening to the right questions, you're not going to get the right answers. That's often something that you don't know until you're actually in dialogue with people. You often there's a lot of hesitance on the part of agencies of various kinds that could be hesitant to use novel data and methods. So that could be related to the type of data that they are concerned about using. It could be related to lack of capacity within their organization. Do they have data science capacity on staff? Are they able to actually support this? It could be related to other issues as well, depending on the geography. And that, I think, is like high touch engagement. And to me, that's actually the reason why localization makes a pretty significant practical difference. So the more that you can move that capacity out into areas that are most proximate to crisis, the more likelihood that you're going to get those kinds of meaningful translational engagements. Otherwise, you're going to be doing analysis into a void or doing it well beyond the time frame of, I mean, don't get me wrong, I love academia, but often it happens at a time frame that's at a remove from where the operational environment is. So we have to kind of keep that thought process in motion at all times to be able to provide support, but then feed that into thinking and research that can sort of meaningfully understand changes to methods and all that kind of stuff. So that tends to be, I think, where the greatest lift is. But yeah, there's work all around.
That's really interesting because I think, on our side, right, in academia, right, when we think about a data-driven project or a product or anything in that space, you would say that the bulk of the work in academic data science, right, is really sort of working with the data, wrangling the data, cleaning the data. And so it's interesting to hear your point of view where you're talking about relationship, really thinking about like narratives and relationships. How do you build those?
And questions. I really do think this is the most important thing, right? Is that and often like we do know what the right questions are, but they're framed differently depending on where you are. Often, questions around what's the right scale, what kind of population are you dealing with, what are the things that you're going to run into as problems that you might not know unless you were actually familiar with the area that you were looking at. Those kinds of things have to feed into the question dynamic, and that is actually what lets you confidently move into the data analysis, knowing that you're actually going to get meaningful results that people will use.
Yeah. Um, so that actually brings me to another question, which is, obviously you've created a platform and a framework that's incredibly robust. Um, Tell me about the challenges of responding in places where maybe you don't have really deep relationships yet, or how quickly, thinking about your workflows, how quickly can you get information and deploy it in a space where maybe you haven't developed those relationships before?
I think it's a really good question. I mean, I wouldn't say it always works perfectly. I mean, just to be totally honest with you, that's the reason why you try to invest on that on the front end as much as possible. I mean, we respond to all kinds of things. So I put the map up at the beginning that shows sort of the global scope of direct relief. And that often means that we do know people that are in an area that they're often, if a healthcare provider is often connected into their public health department or their Ministry of Health. And so there are networks that are represented in that map that are ways to be able to expand out the scope of that activity. So there is a kind of ad hoc social graph that improves your ability to be able to put data to work in a response context. Um, you know, Much better than that is to actually work in advance to sort of make sure people understand what's possible. I think often, we just don't necessarily take the time. Many people don't take the time to sit down with government or with their other nonprofit counterparts or with healthcare providers and really go through like this is literally what we can do in a operational time frame, how that would kind of impact on the kinds of decisions that you're making, and to think, specifically about what would change in those decisions as a result of those new inputs. And that I think is what is the difference between like success and failure in many cases is making sure that people will ask those questions and feel comfortable in advance. But again, yeah, that's a high touch process that we are trying to expand out. So that's why people should get in touch if you want to be able to do that. And we can look at how to be able to expand that out in other areas.
That's really terrific. And you heard him, get in touch. So I'm going to turn to a couple of our questions. Thanks, folks. Keep them coming. Wes Andrews asks, for those of us who are familiar with dealing with humanitarian crises, can you give a general rundown of some of the key software packages you recommend spinning up on to be able to contribute to these data-centric solutions? And I think he's thinking about visual and charting, data aggregation and scraping. How does how does the software licensing issue impact sharing of projects?
That's a good question. I mean, we're pretty software agnostic, honestly. Like R and Python are like the language of data science, and we use both of them depending on the purpose. We integrate with ArcGIS because Esri maintains a robust nonprofit program. So, often Esri is very expensive if you're operating in a commercial environment, but in a nonprofit environment, it's actually quite affordable and accessible. And so there's a range of often a lot of the work we're doing is geospatial in nature, and so that makes a big difference. I've been a big fan of the tool Felt, which is a geospatial platform for collaborative real-time mapping. So through felt.com, you can put data sets into a collaboration environment and annotate simultaneously, like the way you would in a Google document. And so when we're often looking at, what kinds of feedback do we need? You see a mobility pattern in a certain place, and I may not actually be familiar with that, but we work with an agency that's there. We can work in real time to be able to mark that up and then export those annotations and run analysis on how people have annotated the map. Recently used it in a simulation exercise with NASA Lifelines, which is the humanitarian program for NASA, and used Felt to coordinate our simulated health sector response, and it was amazing. I mean, it really worked well because of this fast collaboration. And yeah, I could go on, but those are the sort of main ones. There's a range of Python packages that are worth knowing about if you're doing mobility analysis. So there's a package called MobileKit, which was developed through the World Bank, which mobile you can just Google MobileKit. It's on GitHub, and it's useful for data that has it's collected from a mobile platform that has geospatial information associated with it, and they have really excellent scripting tools that will let you do analysis on GPS data. So that's a pretty good one.
And then I think the last question was, how does software licensing impact any of these solutions or sharing? I mean, you work primarily
Yeah.
open source, is that right?
Well, Esri's not open source.
Oh, that's right.
Felt is not open source, but Felt is connected to open source. So QGIS would be the open source kind of alternative for this, and we use QGIS a lot too. When you're dealing with mapping programs, mainly in Global South or in other places where spending a lot of money on software licensing would be problematic, then yeah, it's much better to use open source solutions. There's a robust community around QGIS. It does integrate directly with Felt, so you can export projects from QGIS into Felt natively. And there's a R and a Python package for Felt that will let you also do that work in an automated fashion, so it can extend into QGIS through scripting languages. I think often academic collaboration has a wider range of software licensing, though. So, one of the things that we've been trying to really emphasize in the kind of capacity networks that I mentioned is that academic, nonprofit, public sector collaboration. So, leaning on to the degree people are based in universities and have access to software licensing through their universities, I think that this is actually one of the great ways to put that licensing to use above and beyond your classes, where you actually can you often have an Esri site license, or you have some other business intelligence license that makes a big difference to this. The last thing I'll just say is that ReadyMapper is openly available, and people can. So if you go to CrisisReady.io/ReadyMapper, you can you can look at events that have been put online. When we put data online, that's available for anyone that wants to come in and use it. So that also can help with extending out some of that capacity to people that are not necessarily downloading and using it themselves.
That's incredibly helpful. Something that I think we've touched on a little bit is sort of the speed to operationalize information. And so Um, we have a question here from Ana Centeno, who asks, how do you balance model accuracy with the need to deliver solutions in a timely manner after natural disaster, right? So how do you, right, going between accuracy and speed? And then how do you communicate this uncertainty with your government stakeholders?
I think this is one of the most important questions. And honestly, I don't know that there's any particularly 100% satisfying answer to this. I mean, I think the best thing to do is to be able to show how representative the sample is. And so we look at, the baseline user base that is represented in a mobility sample relative to the census population as best we can, or we could recalculate that based on gridded population. And we can look at areas where there's high correlation and low correlation. And so you could place a kind of advisory on a particular area that is higher or lower correlation with what we know to the best of our knowledge to be the baseline total population in the area. We don't withdraw that from, and let's say that the correlation is very low in a certain area, and say Hurricane Beryl was a good example. In certain areas of the islands that were hit by Hurricane Beryl, there was actually pretty low correlation with the baseline user base. We don't hide that. We don't say that, well, it's low correlation, therefore don't look at it. We just sort of show what the relationship is, and give some advice on the degree to which you should combine that with other sources that you may be looking at in order to improve your own confidence. I tend to believe more data is better. It's not made up data. It's just not always equally representative everywhere.
That's a really good point. I think that I think that sometimes there's the mistake in assuming that data is truth, but data is incomplete. And I think that, trying to make the assumption that you have sort of the perfect set is really dangerous, especially in these cases.
In
Um,
certain places, you can be very confident, though. I
right,
mean, like
right,
if you're looking in areas of Western Florida, like where I was looking at the evacuation zones, you're looking at a population sample in some cases between 25 and 30% of the total population, which is, it's pretty hard to find a real-time population sample for anything that would get to that level.
right. Um, Sorry, I'm looking at additional questions. So here's a great one. Given that hacking and disinformation operations now occur increasingly, how are you addressing those issues with data assurance and trust?
Boy, if I had the answer to disinformation, I could be elected president. Um, I would say, I mean, to some degree, it's a repeat of the question on uncertainty and methodological education. So, I think it's really important to educate people about what conclusions can be reasonably drawn from data and what can't, and to make that explanation a repeated and core part of your communications. In emergencies, risk communications is one of the most central factors to pretty much anything that you want to do. And so risk communications extends to data methodology and being really clear about how you derive this, where the data came from, make sure that you retain traceability and provenance on data, and so that you're not contributing to um, misinformation by having a bunch of things that don't have the ability to find out where it came from and how it was made. Um, and that's part of the workshop exercises. That's part of, like, I think the value that Harvard Data Science Initiative brings to a lot of these things, to make sure that the curriculum is really clear, and that you're combating potential misuse of data science as part of the public service mission of how this kind of work is pursued. In terms of, like, I mean, there's a lot of questions that you could actually address with this around AI models, and making sure that the models are not only red teamed in terms of the accuracy of the model, but are red teamed in terms of the data inputs to the model. Often that actually isn't done, but could be. So there are ways that you can apply expanded AI safety techniques into like the whole scope of everything that I've talked about so far. And I do think that, like, the exercises that I mentioned are part of that. So you could think of simulation exercises also as red teaming exercises, so that we're looking for areas where misinterpretation is most likely, and where we need to actually get better at conveying uncertainty and conveying what this stuff means, and when you combine it, how you understand the outputs of various models.
Yeah, you actually sort of answered this right just now, but it occurs to me that, obviously in a lot of the media and press, you're going to get a lot of we do see stories about, oh, misinformation after the hurricane,
Right.
do you see now that it impacts, for example, have you been able to trace impacts of misinformation through the models that you're seeing? And is that, so I guess my question is that
Mm.
real? Do you see that
It's a
in the
good.
data?
That's a good thing to look at. I would not say that we've actually seen that, but I think, like, there's a really good example in the case of Hurricane Helene recently in North Carolina, where there was a sort of widespread misinformation about the emergency response itself, and where federal aid workers were subject to threats and harassment, and where there was, a set of claims made about differential focus of the response effort relative to various areas of Western North Carolina, all of which was false. I mean, just showing the data is one way to combat the misinformation, quite frankly. I mean, looking at where people have shifted towards, and then, focusing in on reports of aid activity that come from a variety of different sources. I mean, we scrape that off of public data sources. There's ways to put that. Generative AI, can also help with being able to synthesize large amounts of publicly available text sources that allow you to geolocate aid activities in ways that are, easier to do now than before. And then you locate that relative to what we understand about where people are and where the floodwaters are and where landslide events are. And that actually is an antidote to misinformation. The key is distribution, though. So you have to be able to get into circulation in order to actually be able to have an effect on misconceptions that people have about aid activities. So that is difficult, and that is also why you need that social graph that I mentioned earlier, so that people can do that on your behalf, and trusted voices in the community can become better at being able to circulate information.
Yeah. So I have a bit of an operational question for you, which is, when you do think about these response teams, how do you at Direct Relief, how do you build your response team to a given event? Are your teams, how flexible are you putting together a team and deploying them?
Well, direct relief is interesting in terms of operational model that way. I mean, I would say, in the best sense, direct relief leans hard on localization. So, direct relief is as I mentioned, is a logistics organization. So it's a hub for aggregation and distribution of medical material that occurs in the United States through Santa Barbara, that occurs in Europe, that occurs in Mexico, that occurs through third-party logistics, but the logistics network doesn't really require the deployment of a team. We have emergency response teams that are small, that are people that are skilled in response to emergencies, that have been through a lot of these kinds of events in the past, that understand the logistics dynamics of various countries and various different situations. And so they're there to facilitate the movement of goods, and they're there to facilitate the creation of networks. So often we could start with one set of relationships, but kind of to an earlier question you asked, we often have to scale those relationships. But the purpose of direct relief is not to create parallel systems. It's to make sure that the people that are there long term, that are working locally, that are the health system, whether that's a public health system or whether that's an NGO provider or someone else, that they're the ones that are going to ultimately make the biggest difference long term. They're going to sustain. And so that is really about listening to local people and making sure that you're plugged into the right places that are going to be able to work at scale in those areas. The analytics team, I think, is a little different, actually. So we have a lot of flexibility in terms of being able to onboard new people as needed. I think we form data collaboratives. So we make sure that we are working in partnership with other academics, with the analytics arms of different groups that we're working with. We work, in closely with groups like Data Friendly Space or others. That's just like the purpose of the data collaborative, which is a term I take from Stefan Verhulst at NYU, is around being able to have these sort of rapid, flexible groups of people that are familiar with the data, familiar with the methods, and that can be temporarily responsive to questions. And I think the COVID-19 network is an example of that, but we replicate that in response activities all the time. And mostly you just have to trust that you're talking to the right people. I mean, I don't know, it varies.
I feel like that's the theme of this whole conversation, right? It's all about the trust in the relationship. So I
Yeah.
like to close these seminars with one question for our speakers, which is, for folks out there who want to brush up, want to read more, do you have any reading recommendations? What has excited you in the literature the last,
Is
the
this the
last
Ezra Klein question? What are
It,
three
oh,
books?
it is. Now that I realize that, I didn't mean to do that, but yeah, yeah.
Um, uh, well, actually, I mean, I would recommend there's a paper that my colleagues Sacha Balsari and Carolyn Bucky put together that was in the New England Journal of Medicine a couple years ago called Data in Crisis, Rethinking, I forget what the full title is, but they did a really tremendous job of articulating this problem of sort of how we use novel data and official data in combination at different temporalities for making effective, practical decisions in crisis. And so, yeah, that's 2022 from New England Journal of Medicine. It's through, you can get it through the site. I do think that I always recommend Stefan's work. We did a paper with him on rapid data collaboratives through UN University recently, which again, you can get through the site, that looks at exactly like what are the issues you need to be mindful of when putting together a rapid data collaborative. So looking at these issues around cataloging questions, around rights to data, around making sure that you have networks of data stewardship in place so that we can work effectively with the private sector to access data resources, and sort of simultaneously with our counterparts within government to form these sort of transitional relationships. So that's a really good one as well. I could probably name Kurt Vonnegut. You should read a lot of Kurt Vonnegut.
I think that was John Stewart's response. All right. Well, thank you. Thank you so much for your talk. Thank you so much for your questions, audience. I think it's time to say goodbye. This is our last industry seminar of the calendar year. We'll be back in the spring. Also, folks should be on the lookout for news about our annual conference, which is open to the public. We'll be releasing information soon via our newsletter and socials, and we hope to see you there. So with that, I'm going to say thank you, Andrew. This has been really
Thanks to you. Thanks to Harvard Data Science Initiative for all of the support and all of your insight over the years. It's been really great.
Yeah, we love working with you, and we really hope to continue. So, all
Thanks a
right.
lot.
Take care, everyone. Have a great afternoon.
Take care.